I'm Betty Stewart. I am a mother, a grandmother. I am also with Windsor Village Church Family. I am the Congregational Care Coordinator and Community Resource Liaison. I am on assignment for the Holy Spirit to make sure that you understand that your health is your wealth and that everything that encompasses you, you need to make sure that you meet your challenges the best way you possibly can.
My name is Dr. Cynthia Turner.
Mm-hmm.
I am a wife, a mother, a grandmother, a minister, an educator, and most importantly, a child of God. I cannot express my appreciation to all who are on this journey to spread the good news of health and going beyond surviving and thriving. Your words of encouragement, your words of life, your willingness to share resources and share your testimonies will impact our communities in ways that only can be repaid through your work will be blessed and multiplied by what you do for others. It's purposeful, it's impactful, and I just say thank you.
I think that we had a lot in common.
Oh my.
I mean, that we didn't, and not even knowing each other.
Right.
Mm-hmm.
I think a lot of it had to do with us looking at taking ownership of our health.
Yes.
Like in a way that most don't.
Right.
Right. Questioning.
Yes. Yes.
Practices and even for you, even advocating to the extent that you ended up having them change how they treated you.
Right.
That was amazing. Like, wow. And now they even now do it differently.
Yes, they do.
No, I thought that was really a wonderful insight. Because doctors practice.
But I had a dual purpose. I was doing it for myself, but I was also learning of what I needed to do for others.
Yes, that's right.
You remember?
And so, no, you're right. In your perspective of being given that assignment,
yes,
before you were going to have to, lead by example.
Yes.
So you knew your purpose was bigger than yourself.
Yes, it was.
From the beginning.
From the very beginning. I knew it had nothing to do with me.
Right.
It had to do with the calling.
Wow.
What that assignment was going to entail.
Yeah, no. I think that was very insightful to me. Yeah. And I think for myself, it was the same. I knew it was bigger than myself as well. And I think that was how as for me, I was able to create a narrative.
Right.
That kept me mentally focused and positive.
Right. Because you even mentioned the fact that God was going to show your husband.
That's right.
And healing.
That's right. But let me clarify, because I've taken on this to be something I said, but I was reminded when I was reading, going back through my book, that my husband actually said that.
Okay.
That and it was a story. I was reflecting on a story when as soon as we got the news, how I went back to work, and so I thought my husband had too, and come to find out he came home, and because he said he was not like me, he needed more time to process, and it was during his time home that he said God was going to show him that he was more than just a comforter.
Yes.
That he would show himself to be a healer. And so I'm grateful that God revealed that to him. because that was also another way for me to look at how I was going to fight this battle.
Right.
Yeah.
Confirmation.
It was,
Yes.
absolutely.
Yes.
Especially having my husband having gone through two deaths that were related to cancer,
Right.
from his mother and his father. So, yeah, I thought that was insightful, just how we understood this to be bigger than
Yes.
us. I also thought it was really very interesting that we also took ownership, like I said, early on about how we were going to battle this, even if that meant, directing our doctors in ways that
Yes.
most don't consider.
That's right.
Yeah. And so if
Well,
you could share again, how you thought, because you and I had the same issue when it
Yes.
came to radiation.
Yes.
Yeah. I would love for you to speak more about how you got to that point of saying, hey, now can we do it a little differently, the whole approach?
Yeah.
You want to share more
Yes.
about that?
Yes. I was thinking at the time when they were showing me, illustrating to me exactly the markers they were going to put on my body
Uh-huh.
and how I couldn't wash the markers off because that's what they were going to use. And then when they started telling me how they were going to lay me on the table on my back and how then the treatment of the radiation would go straight to the breast.
Right.
But we're talking about the left breast.
Right.
So we're talking about your heart.
That's right.
Is there.
That's right.
And it wasn't about me. I think it was truly the Holy Spirit that was telling me what to say and giving me the direction of what I needed to advocate for myself.
Right.
And I had never had to advocate for myself before. I had never been in that position. But then, I was thinking, I need to really protect my heart because it's over there.
That's right. That's right. That's right.
And and so that's why we had the conversation. And then I said, well, just think about what I'm asking and see what the possibilities are. And it worked that way.
So did you present them with that option of the actual way it ended, or was there a discussion of possibilities?
No, I presented them with the option, and they listened to me.
Wow.
Which I didn't know how that was going to work out, to be honest with you.
Right.
But and keep in mind, I had never been in that position before, so I wouldn't necessarily have any experience of what I'm telling you to do.
Right. Right.
Because
telling a doctor that.
Yeah, that's right.
Right.
And at the number 1 cancer center.
Wow.
We're not talking about.
Yes, that's right.
That's the best in the land.
That's right.
And so I'm telling you that with conviction.
Right.
I'm not stuttering through it. I'm not trying to say that this is something that I'm guessing about.
That's right.
I just knew that you needed to protect my heart.
Right. Right.
When I was first told that I had the breast cancer, and they started explaining to me, what the process was going to be. First, I would have surgery. It would be outpatient surgery. So I would go home the same day. But then after that period of time of healing, then I would come in and start the radiation treatments. And so from the radiation treatments, that's when they started explaining to me exactly what that process would entail.
Right. Okay, so even go back. What was your diagnosis? Okay. And why did you only need radiation?
Okay, my diagnosis was ductal carcinoma, cancer, which that's really cancer in your milk ducts. And because I had 2 tumors the years before,
okay,
I was told that I needed to have a mammogram twice a year.
Okay.
So from those twice a year mammograms that I was taking, that was the results of the final one, So I didn't expect anything to happen because I'd already had tumors before, one in each breast, and they were benign. You know? So I was thinking, okay, I'm going to be fine. Nothing's going to happen with this.
Right.
But then it turned out actually to be cancer, but it was stage 0.
Okay.
I didn't know stage 0 existed.
Right,
I was
right, right.
familiar with stage 1 through 5,
That's right,
but I
right,
didn't know a 0 existed, to be
right,
honest.
right,
Hmm.
right. So when you were told that it was stage 0,
Hmm.
surgery after surgery, and then you said it was radiation, you found it was in your left right side.
Right. Hmm.
And then when they started talking about radiation, you started getting concerned
Right.
about the heart.
About my heart, yes.
Yeah,
Hmm.
yeah. And how were they? You saw how they were positioning you.
Yes.
What were your questions that you asked?
Well, I was asking, like, how often will I have to have these treatments? How long will they last?
Mm-hmm.
And they were giving me the information,
Mm-hmm.
and then they were explaining to me that that the people that work in the radiation room, they have to be relieved for a period of time,
Mm-hmm.
so that they're not taking in more radiation than their bodies can handle.
Yeah, yeah,
And
yeah.
and so they gave me all that information too. Well,
Mhm.
that triggered me also.
Right,
Like,
right.
you work here, you can't come in.
Right.
And then when I saw that door
Mhm.
that was so big and full of concrete or
Mhm.
whatever was behind it,
Mhm.
and then the fact that they could see me through a glass, window, but
right.
that they couldn't be in there with me at all.
Right, right.
That was concerning as well.
Right,
I'm
right.
like, okay, you're treating me, but you can't even be a part of the treatment. So
Right.
this is really serious.
Right,
Mhm.
right,
Mhm.
right. And so then as you were seeing how they were positioning you,
Yes.
you realize, okay, radiation is going to be near my heart.
right.
How are we going to minimize that?
Mindset, right. And that's
right.
what I was concerned about.
Yeah.
Because I didn't have any heart trouble
Uh-huh.
whatsoever,
Right.
and I didn't want any either.
Right, right. And what's interesting is that you and I had the same concerns, right? Mine
Yes.
was on the left side.
Mm-hmm.
I was stage 2,
Mm-hmm.
but I too was like, wait a minute. So what does this mean about my heart?
Mm-hmm.
And what did the doctor say to you? The doctors said the very same thing. They come from the same textbook.
Textbooks,
Yeah.
yes.
What did they say to you?
They're going to cover it. They're going to do it the best they can to protect the
Right.
heart.
And and basically they said we're going to minimize,
Yes.
but they couldn't eliminate.
Right.
And so
That was concerning.
absolutely, absolutely, because from that I knew. I say, so by that, what does that mean if you're minimizing? Well, maybe in the next 5, 10, 15 years, perhaps heart failure.
Mm-hmm.
So that was concerning to me.
Yes.
Like, wait, so I may not die from breast cancer, but I will have issues with heart failure.
Right.
Now, you were how old when you were diagnosed with this?
I was in my 50s.
So, and I was 38.
Right.
So for me, that was even more concerning.
Oh, of course.
Because 5, 10 years, I'm still
Mm-hmm.
Under 50.
50, right.
And thinking about that piece. So I'll share a bit, for me, I, unlike you, did not have any concerns about breast cancer at that point.
Mm-hmm.
I didn't know, as you and I talked about cancer, you called it the big C?
See, yes.
It is something often in our communities that we just don't talk about.
Right.
So for me, it was not something I was concerned about. And in fact, I was just going for my annual physical.
Mm-hmm.
And I now recall that at the time, at the top of my list was I had a hernia from my last son. I had some other cosmetic things I was thinking about. And it was my doctor during that conversation that she's doing a breast checkup for me, and she feels something. And for me, it felt like it was under my arm. It wasn't, around the breast. And in fact, I thought she was just kneading into my my rib cage. And so she kept saying, do you not feel it? And she kind of pulled it out, and then she rolled over it. And when I think of a lump,
yes,
I don't think of what I felt. First of all, I didn't expect it to be up under my arm so much. And it felt like a hard rock, like a little hard rock. And she goes, I think maybe it's just a fibroadenoma, which is very common for Black women.
Right.
And so, of course, I didn't think much of it. Woman of faith. I know this is, if that's what you say it is, that's what it is, right? But she did proceed to say, well, just in case, just to be sure, let's do a mammogram and an ultrasound. Understanding I hadn't had a mammogram before then because I was under 40.
Right.
And so that wasn't, necessary at that time. And it wasn't until the mammogram didn't show it. Now, I want to be clear, it was the ultrasound
Yes.
that actually showed that it was a cancer, breast cancer. But I was stunned. And, I think about that time frame. There were a lot of things happening, and you and I talked about that, some of the common things that we deal with. I was a young mom. I had a son that was 8 and a son that was 4, just been married maybe 10 years out. I was assistant professor at the University of Illinois, and so I was trying to do it all.
Oh, yes.
I think a lot of times we think we're super women, and so I was. And the last thing you think about at that point is your health, especially at 38, because at this point you have not realized that you are mortal. So you're still doing the things you did when you were 17 and 18, and just instead of putting or getting removing things from your plate, you're just adding it on and saying, well, I can do this, right? So for me, I remember going through that, like, what does that mean? Going from a conversation of getting a hernia fixed to, okay, now we're talking about getting your breast potentially removed, going through chemo, radiation, and all of that, because at that point, they didn't know what it was. So they were going through all the possibilities. And so I remember that very vividly. So for you, after you realized that you had this, what did you do next for mental, emotional support? How did you handle that, the diagnosis and your finding that out?
Well, I had some lengthy conversations with the Holy Spirit, and because of the fact that within about 3 weeks I had been given the cancer ministry at the church.
So was that 3 weeks before?
Yes.
Okay, please set that up, because that really moved me from yesterday's conversation. So what transpired before you got that diagnosis, and how did that set you up as far as your mindset?
The pastor that I was working for at that time had given me several ministries to manage and to develop the leadership and the members of how to, handle different health events. And then she decided that she would give me the cancer ministry.
Wow.
Well, that blew my mind, because I was like, man, I don't know anything about cancer.
Come on now.
All I've ever heard was it's the big C, and people don't like to talk about it. It's a secret, And I said, what am I going to do with this ministry? How am I going to help develop these people, and what do I do?
Wow.
So I was having this conversation with the Holy Spirit, and I was saying, okay, you've got a little sense of humor here. So you've given me this assignment, so I know you're going to show me how to do it. What should I do? How should I process this?
Right.
What are you going to teach me, in this process?
Right.
And within 3 weeks, then I find out I have cancer. And so I'm saying, okay, since you could have walked me through that very simply and told me what to do,
and not have to go through it.
right? I said, but since you're taking me through this journey, I don't want to miss a thing. Whatever it is you want me to learn, whatever I'm supposed to glean out of this experience, for not just myself but for others, then I need to make sure that I'm not missing anything. I want all the details clear.
Right.
And what am I supposed to learn from this?
Right. No, I totally, I think that frame, was, while it was different for me, knowing that I was doing this because I knew God was going to show up for my husband, indifferently, but it was still that mindset that this was bigger than us.
Yes. Oh, yes.
And that understanding, and my pastor used to say this all the time, trying to get traction out of trouble.
Yes.
You should always look to try to get traction. So for me, this trouble was, okay, how do I make this get something good out of it?
Yes.
So I know I have a lot of sisters and brothers who are going through this experience who have mentally gone through it in different ways. I tried not to focus on why, but like you said, the what.
Yes.
What am I to get out of this? And how can I be a blessing to someone else?
Right.
Because when you think it's bigger than you, then you can't focus on you.
That's right.
So then the self-pity, the self-doubt, all because you're going, oh no, because this got to be bigger than me. And I think that mindset helped us on this trajectory, right? Because you were diagnosed when, because I think everyone needs to understand that when I talk about 5 or 10 years ago, when were you diagnosed?
I was diagnosed on the first Sunday in October 2005.
Wow. And I was diagnosed October 16th, 2006. And I am so grateful to be able to say that, because at the time when I was diagnosed, they were talking about what survival looked like for 5 or 10 years out. And that was concerning to me.
Yes.
I have 2 young sons. I wanted to see them grow, and I wanted to see them graduate. I want to see them get married. And this idea of 5-10, I like the idea, but I wanted to see something more long term. So for us to be standing and sitting here talking about that today just talks about the goodness of God.
Yes.
And I will want to mark something, because it dawned on me yesterday as we were talking about dates, and I was thinking about when things happen. I would be reminded that how faithful God is, because one of the things I said, I was going to share it with everyone. I said, every moment you gave me, I would always give you glory for this.
Yes.
And I've been teaching now for almost 30 years. And every semester, as I introduced myself, I shared this experience. And the reason I shared it with them, because many of our bad habits start when we think we're grown, which is in college.
Yes.
Secondly, I wanted to make sure the students knew that I was human and that I had gone through some things. And out of that experience, I've had students who would share with me, parents or family members or themselves going through things, and helping them to actually see what the other side could look like.
Yes.
But in my being really committed to telling my story, I was first, when I told you the story, when she came in and she identified the lump. That was September the 27th. As we talk, I am preparing for my son's wedding on September the 27th of this year.
What a blessing.
And I think about what I asked God when I started this. Lord, I want to see my children grow up, and I want to see them go through these experiences, and to have this conversation with you in this moment, to just even think, wow, how he's still showing himself faithful,
right,
and honoring that. So I think it's really important that others who are listening recognize that God does honor that when we think bigger and being more willing to share.
Yes.
Because isn't that something I know you mentioned, that it was important for you to lead by example, because now you were leading the cancer ministry, right? So talk more about, I've said my part. How about how it's shown up for you to walk in that journey and share with others in ministry?
I've learned a lot. I've learned that to walk in a cancer journey is not something that you should walk alone.
That's right.
You need to make sure that you're sharing your experiences with others.
That's right.
And that you're praying on a regular basis.
That's right.
Not just for yourself.
That's right.
But for your medical team as well.
Yeah.
Because it's a partnership.
That's right.
And you know, those
talk about
doctors,
that.
those doctors are in place because God put them there.
That's right.
But they need to be wise and have discernment about
Right.
the treatment plans that they're offering their patients.
That's right.
So you want to make sure that that team is under God's leadership
Right.
and going in that direction.
Right.
And so it was important for me to make sure that I taught the leaders in the ministry
Mm-hmm.
and the members in the ministry that when we go forth to pray, we also pray for the medical team.
Right.
And that includes the people that clean the rooms.
That's it.
Because
right.
you have to be in a sterile environment.
That's right.
So every member of the team is important.
That's right.
I also taught them to make sure you pray for the equipment because a lot of equipment malfunctions.
That's it.
You
That's
know?
it.
And
That's
so
true.
you don't really realize if something malfunctioned and you're getting the test.
That's right.
From that piece of equipment. So you want to make sure that you cover everything.
That's
you
right.
know, in detail.
That's right. And you know, part of that prayer for me, and so what you said, I think is really critical. Oftentimes when people go through illnesses, they just say, "Pray for me."
Yes.
I wanted specific prayers.
Yes.
And so I
Details.
listened. I told them everything after every doctor's appointment. They would tell me all of the things that could go wrong,
Right.
what the adverse side effects would be, and I would write them down so I would share with my prayer group. This is what I need you to pray against.
Yes.
And so I'm very particular. And when the folks say, "Hey, can I pray? Would you pray for me?" I say, "May I ask what I'm praying for?" Because I think it's important that what you put out there, that you, as much as people are comfortable with, that, you know, it gives you a sense. For me, at least when I'm praying, it's as much as you're, you know, directional to God, but it's also kind of helping you understand what you're saying you want God to cover. Because what you say and how you say things, and we talked about this a lot, we think I felt like that was 90% of my battle. Putting things out there and speaking that which I desired, right?
Yes, right.
Versus what I was fearful of. So it was the way I phrased things. So if they said, "Oh, you were going to experience pain," I was like, "Lord, I just thank you for how you're going to cover me, and I'm not going to experience that." So in a way, because your mind does some strange things.
Oh, yes.
I remember, and I was sharing with you when I was diagnosed with breast cancer. I remember up until then, I didn't know I had it, right? I'm walking around. In fact, I found out I was even walking around with pneumonia, and that tells you how insane we can become as far as not thinking or listening to our bodies. But as soon as those words came out of the doctor's mouth, I remember literally experiencing symptoms, physical symptoms while I was asleep that didn't exist prior to those words. And that's when I realized the power
Of the words.
you speak to others and to yourself.
Right.